Welcome to the deep dive. Today we're tackling something pretty important for our pets, specifically dogs and sometimes cats. Gastroduodenal ulceration erosion, or GUE.
That's right. It sounds technical, but we're basically going to break down what it is, what triggers it, and, what it tells us about animal health.
Exactly. And we're pulling this from a detailed medical reference, so it's solid info. Think of it as a concentrated look.
Yep. We'll unpack the key bits, the body's defenses, the triggers, the treatments, trying to give you a clear picture.
Okay, let's jump right in. GUE. What exactly is it? Like, what's happening inside?
Okay, so fundamentally, GUE means there's damage to the lining, the inner surface of the stomach, and the very first part of the small intestine, the duodenum.
Damage.
Yeah, when you make a distinction, ulcers are, well, deeper. They go all the way through that inner lining, the mucosa. Erosions are more superficial, just sort of scraping the surface partway through.
Got it. Deeper versus shallower damage. Now, the stomach's full of acid, right, for digestion. What stops it from just digesting itself normally? What are the body's own protections?
That's a great question, and it's key to understanding GUE. The stomach has some really clever defenses. First, there's this mucus bicarbonate layer. Think of it like a thick, slimy shield that neutralizes acid right at the surface.
Like a built-in antacid layer.
Exactly. Then, the cells lining the stomach, they turn over really fast. Old ones get shed, new ones replace them constantly.
Okay.
Good blood flow is also vital. It brings oxygen and nutrients in, takes waste products out, helping repair any minor damage. And finally, there are prostaglandins.
Prostaglandins?
Yeah, they're like local chemical messengers. They help keep that blood flow going and stimulate mucus production. GUE basically happens when these defenses get overwhelmed or broken down.
Makes sense. The shield gets weakened or breached. So, where do these ulcers and erosions usually show up? Is it always in the stomach?
Most often, yes, in the stomach itself, and that initial bit of the intestine, the proximal duodenum. But it's worth noting, certain things like cancers or specific drugs.
Like which ones?
Well, like flunixin meglumine, that's an NSAID. They can actually cause ulcers pretty much anywhere along the whole GI tract, not just the stomach or duodenum.
And I imagine this isn't just a local problem, right? If you've got bleeding or damage there, it can affect the whole animal.
Oh, absolutely. It can have systemic effects. Bleeding's a big one. If it's slow and chronic, you get anemia. If it's sudden and severe, you can see a fast heart rate tachycardia, maybe even a heart murmur develops, and low blood pressure, hypotension.
Okay.
And the really scary scenario is perforation. If that ulcer eats right through the wall.
A hole.
Exactly. Stomach contents leak into the abdomen. That causes peritonitis, a massive infection, which can lead to sepsis and something called SIRS, systemic inflammatory response syndrome. Basically, the whole body's inflammatory system goes haywire. It's life-threatening.
Wow, okay. That's definitely serious. How common is GE? Is this something vets are seeing all the time?
It might be more common than you think, especially in certain groups. Like there are studies showing a really high incidence, maybe 40 to 60%, in exercising Alaskan sled dogs.
Really? Sled dogs? Just from exercise?
Yeah, it highlights how intense physiological stress can be a major trigger. We also know it's, well, relatively common in dogs getting NSAIDs, nonsteroidal anti-inflammatory drugs, or the steroid dexamethasone.
Both very common medications.
They're very common. So it shows how these helpful drugs can sometimes, disrupt those natural defenses we talked about. It's a trade-off.
That sled dog example is fascinating, really drives home the stress connection. And the medication link is crucial for owners to understand. Are certain types of animals more likely to get GUE in general?
Generally speaking, we see it more in dogs than in cats. Cats seem a bit more resistant, though they can still get it.
Oh.
And there are some breed predispositions, particularly when we talk about stomach cancer, gastrocarcinoma, which can cause ulcers. Breeds like Chow Chows, Rough Collies, Staffies, Belgian Shepherds, they seem to be at higher risk for that specific cancer.
Any age or sex factors?
GUE itself can happen at any age, really. But for gastrocarcinoma specifically, there tends to be a higher incidence in male dogs.
Right, so if a dog does have GUE, what signs should an owner look out for?
Well, this is where it gets a bit tricky. Some animals, especially maybe those on NSAIDs or dexamethasone or sled dogs even, might not show any outward signs. They can be asymptomatic.
No signs at all.
Sometimes.
Yeah.
But the most common sign when there are signs is usually a poor appetite, hyperexia, just not eating well.
Okay. What else?
You might see vomiting, sometimes evidence of bleeding like vomiting out blood, which is called hematemesis, or having dark, tory stools called melena, that's digested blood.
Melena, right.
But interestingly, how sick the animal looks, doesn't always match up with how bad the ulcers actually are inside. You could have severe ulceration with mild signs, or vice versa.
Huh.
Very rarely, you might see a dog in what's called the praying position, front end down, back end up. It suggests pain in the upper abdomen.
And in severe cases?
If there were complications, like major blood loss or that SIRS thing we mentioned, then you'd see more dramatic signs. Weakness, really pale gums, lethargy, maybe even collapse.
But you said a physical exam might be normal.
Often, yeah.
Yeah.
Especially in milder cases. And Melena, that classic sign of upper GI bleeding. It's actually not seen all that often, even when bleeding is occurring.
Good to know. So a lack of obvious signs doesn't rule it out.
Let's dig into the causes more. We've mentioned drugs, NSAIDs, and steroids. Can you expand on that?
Sure. NSAIDs are definitely a big category. Now, there are newer ones called COX-2 selective NSAIDs, which are generally thought to be safer for the stomach than the older non-selective types.
Why is that? Well, the older ones block two enzymes, COX-1 and COX-2. COX-1 helps protect the stomach lining. COX-2 is more involved in inflammation. So the selective ones target COX-2 more, aiming to spare COX-1.
Makes sense. Less collateral damage to the stomach.
In theory, yes.
Right.
But it's really important to understand that any NSAID, even the COX-2 selective ones, can still cause GUE, even perforation. The risk isn't zero.
Right.
And that risk goes way up if you give NSAIDs at the same time as glucocorticoids like prednisone or dexamethasone, even if the steroid is given locally, like an injection into a joint.
So combinations are particularly risky.
Definitely. And some specific NSAIDs are known to be, well, highly ulcerogenic. Things like flunixin, miglumin, naproxen, and endomethacin and vets tend to be extra cautious with those.
And what about the steroids themselves? You mentioned dexamethasone.
Yeah, among the glucocorticoids, dexamethasone seems to be more strongly associated with causing ulcers compared to, say, prednisolone. Prednisolone is generally less likely to cause GUE unless there are other stressful things going on, like poor oxygen supply or low blood flow.
Okay, so it's complex, not just the drug, but the specific drug, combinations, and the animal's overall state.
Exactly right. And then, beyond drugs, there are actual diseases of the GI tract itself.
Like what?
Cancers are a big one. Carcinomas are the most common type of stomach cancer causing ulcers. But other tumors, like leiomyomas or leiomyosarcomas, muscle tumors, they're kind of notorious for causing really severe bleeding.
Wow.
And in some parts of the country, there's a nasty fungal-like organism called Pythium. Pithiosis causes severe, often hard-to-treat GUE. It seems to be spreading, too.
A fungus causing ulcers.
Technically an oomycete, but yeah, causes nasty inflammation and ulceration. Foreign objects can sometimes be involved, although maybe less often as a primary cause of stomach ulcers. Intestinal foreign bodies, especially linear things like string, are definitely a major cause of ulceration, perforation further down. And sometimes the stomach just produces way too much acid, hyperacidity.
Okay. What about other types of diseases? Infections, metabolic problems.
Yep. Infections, again, pitheosis is one to remember there,
Right.
and certain metabolic diseases can increase the risk. Things like liver disease, Addison's disease, that's hypodrivenocorticism, and pancreatitis have all been linked.
Addison's. How does that link?
The lack of cortisol in Addison's can impair the body's ability to maintain the gut lining and respond to stress, making GUE more likely. It's complex.
Interesting. Any other causes?
Well, rarely. Toxicity from heavy metals, arsenic, zinc, thallium, iron, lead can do it. And we mentioned GI cancers, but other cancers elsewhere in the body can indirectly cause GUE.
Ah.
Certain tumors, like mast cell tumors or gastronomas, can release substances that cause the stomach to produce way too much acid. It's a perineoplastic effect.
Gotcha. And finally, stress. We keep coming back to that.
We do, because it's so important. Major systemic stress is a huge factor. Things like shock from trauma, surgery, whatever, causes really low blood pressure, or that SIRS condition we talked about.
From heat stroke, maybe? Sepsis.
Exactly. Severe burns, too. And tying back to the start, that sustained, strenuous exercise, particularly in tough environments like extreme cold or heat, it just pushes the body beyond its normal coping mechanisms, and the gut lining can suffer.
So, if we were to summarize the biggest risk factors, we're talking ulcer-causing drugs like NSAIDs and dexamethasone,
Right.
conditions causing poor blood flow like shock and SIRS,
Yep.
and that really intense exercise.
And those are the major ones, yes.
Okay. So let's say a vet suspects GUE based on signs or risk factors. How do they confirm it? What's the diagnostic process?
Well, first, you often need to rule out other things that could cause similar signs, like Is the vomiting actually from esophageal disease? Is there a blood clotting problem causing bleeding? Could the animal be coughing up blood from the lungs and swallowing it?
So initial tests might look broader.
Yeah, you might do chest x-rays, check clotting times, maybe even an esophagoscopy, looking into the esophagus with a scope. Then for GUE specifically, standard blood work, CBC, chemistry, and a urinalysis are usually done.
What can those tell you?
They can show signs of blood loss, like anemia or low protein. Sometimes, with really sudden bad GI bleeding, the ratio of BUN to creatinine in the blood work can be high because digested blood gets absorbed as protein.
Yeah, okay.
Depending on the case, other tests might be needed. Checking stool for parasites, testing liver function with bile acids, maybe a cortisol level to screen for addisons, or, rarely, measuring gastrin levels if a gastronoma is suspected.
What about imaging? X-rays, ultrasound.
They have a role, but they're often limited for seeing GUE directly. X-rays might show a foreign object or signs of a perforation, like free air in the abdomen. Ultrasound is better for looking at the layers of the stomach wall.
Can it see ulcers?
It might show thickening or changes in the layers, maybe a mass or fluid buildup suggesting peritonitis, but it's not great at detecting those superficial erosions or even some smaller ulcers. It can easily miss them.
So if imaging isn't the definitive way to see GUE, what is?
Endoscopy, by far the most sensitive tool.
Putting a camera down there.
Exactly. A flexible camera goes into the stomach and the upper duodenum. You can directly see the lining, identify ulcers, erosions, inflammation, masses.
And you can take samples.
Yes, and that's crucial. Endoscopy allows for biopsies taking tiny tissue samples. It's usually recommended to biopsy not just the lesion itself, but also the apparently normal tissue around it. This helps pathologists get the full picture.
Any risks with biopsy?
There's a small risk of causing a perforation if you biopsy right in the center of a deep ulcer, so vets are careful. If perforation is already suspected, they might do an abdominocentesis, taking a fluid sample from the abdomen with a needle to check for infection.
What about surgery? Can't you just open the animal up and look?
You can, but surprisingly, it can be hard to spot subtle ulcers or erosions just by looking at the outside of the stomach or intestine during surgery. Endoscopy is much better for visualizing the lining itself.
Okay, endoscopy is key. Once it's confirmed, maybe with biopsies, what do these lesions actually look like pathologically?
Visually, during endoscopy, they're usually pretty obvious red cratered areas. The body of the stomach and the antrum, the lower part, are common spots, especially with NSAID or dexamethasone use. Ulcers in that first part of the duodenum can point towards excess acid, but not always.
And under the microscope?
The biopsies might show inflammation, maybe cancer cells if that's the cause, or you might even see the fungal organisms if it's something like pitheosis.
Right. Okay. We've covered what it is, causes, diagnosis. Let's talk treatment. What's the game plan?
The absolute #1 priority is to identify and remove or treat the underlying cause. Stop the offending drug, manage the shock, treat the underlying disease. That's critical.
Does it sometimes get better on its own if you remove the cause?
In some milder cases, yes, especially if the trigger is relieved quickly. But usually treatment is needed. Supportive care is also really important.
Like what?
IV fluids are often crucial to restore hydration and maintain good blood flow to the stomach lining, which helps healing. If there's been significant blood loss, blood transfusions might be necessary.
What about activity and food?
Activity usually needs to be restricted, just based on how the animal feels.
Yeah.
And when they start eating again, the recommendation is typically small, frequent meals of something bland and easy to digest, low fat, low fiber.
Makes sense. Now, what about advice for pet owners? Key takeaways for managing this?
Yeah, there's some really important points here. First, owners need to understand that dogs are just more sensitive to NSAID side effects than people are. The drugs often last longer in their system.
So no giving human NSAIDs?
Absolutely not, unless specifically directed by a vet. Never give Advil, Alev, anything like that. Even baby aspirin, sometimes used for blood clotting issues at very low doses, carries a risk.
What else should owners watch for with NSAIDs?
Be aware that just going off their food, that hyporexia might be the first and maybe the only sign that an NSAID is causing a problem.
That's subtle.
It is. Also, always give NSAIDs with food. It can help buffer the stomach a bit.
Does the vet sometimes give preventative meds with NSAIDs?
Yes, especially for long-term use. They might prescribe a proton pump inhibitor, a PPI. Although another drug, misoprostol, is often considered even more effective specifically for preventing NSAID-induced ulcers.
Okay. And what about dexamethasone? You mentioned that earlier.
Right, and this is a huge point. Currently, there is no medication that has been proven effective in preventing GUE caused by dexamethasone.
Wow. So if a dog needs dexamethasone, you just have to monitor closely?
Exactly. Monitor very carefully for any signs because prevention with drugs isn't really an option like it is with NSAIDs.
That's a critical distinction. What about surgery as a treatment, not just diagnosis? When is that needed?
Surgery comes into play mainly for complications. If there's life-threatening bleeding that can't be controlled, sometimes endoscopy can be used therapeutically, try to cauterize the bleeder or inject something. If that fails or isn't possible, surgery might be needed to remove the ulcerated section or oversew the bleeding vessel.
What if medical treatment just isn't working?
If an animal isn't improving after, say, 5 to 7 days of appropriate medical therapy, then surgical removal of the non-healing ulcer might be considered. And sometimes, rarely, they might need to do endoscopy during surgery to find tricky lesions or even telescope the intestines to examine the lining carefully.
Okay, let's talk about the main medications used to treat GUE. What are the go-to drugs?
The cornerstones are drugs that reduce stomach acid and protect the lining. The most powerful acid reducers we have now are the proton pump inhibitors, or PPIs.
How do they work?
They basically shut down the little pumps in the stomach cells that secrete acid. It's a very effective mechanism. They take a few days, maybe 3 to 5, to reach their absolute maximum effect, but even from day 1, they're generally better than the older H2 blockers.
Which specific PPIs are used?
Common ones are omeprazole, esomeprazole, and lansoprazole. Those are usually given by mouth. Pantoprazole is one that can be given as an injection, which is useful for animals that are vomiting or can't take oral meds.
You mentioned H2 blockers. Are they still used?
Yes, they are. Histamine H2 receptor antagonists. They work differently by blocking histamine signals that tell the stomach to make acid. They're generally less potent than PPIs, though.
Examples.
Famotidine, that's probably the most potent and commonly used one now. Ranitidine used to be popular, but has had some availability issues. Nizatidine is another. An older one, cimetidine, is usually avoided because it has more drug interactions. There's a newer one, lifutidine, but not much experience with it in pets yet.
Okay, so PPIs are preferred, but H2 blockers are an option. What else?
Sucralfate is very important. It doesn't reduce acid, but it acts like a sort of bandage for the ulcer. It binds to the damaged tissue, forming a protective layer over it. It might also stimulate some of those helpful prostaglandins locally.
How is it given?
Usually as a liquid or a tablet that's dissolved in water, given a little while before meals and other medications.
What if the animal is vomiting a lot?
Then antiemetics are needed. Meropitant is a common one, available as injection or tablets. Ondansetron is another good option, often given IV in the hospital. Basic over-the-counter antacids like Tums, generally not very effective for treating significant ulcers.
Got it. Any interactions to worry about with these meds?
Yeah, the main thing is that sucralfate, and maybe antacids if used, can bind to other drugs and reduce their absorption. So you usually need to stagger the timing, give sucralfate maybe an hour or two apart from other oral meds.
Okay. And you mentioned misoprostol earlier for NSAID ulcer prevention.
Yeah.
Is it used for treatment too?
Yes, it can be used to help treat existing NSAID-induced ulcers as well. It's a synthetic version of prostaglandin E1, so it helps restore some of those protective mechanisms that NSAIDs block.
But that warning.
Absolutely critical warning. Misoprostol can cause uterine contractions and abortion. It should never be used in pregnant animals, and pregnant women should be very careful handling it.
Okay, super important. So once treatment starts, how quickly should owners expect to see improvement?
If the underlying cause is addressed and the medications are working, you generally hope to see noticeable clinical improvement, better appetite, less vomiting within about 5 to 7 days.
We've hit treatment hard. Let's quickly recap prevention again. Key strategies.
Okay, quick recap. Give NSAIDs with food. Always. For long-term NSAID use, talk to your vet about concurrent gastroprotectants, a PPI, or maybe misoprostol, which might be better specifically for NSAID protection. And remember, even the safer KOX2 selective NSAIDs aren't risk-free.
Good summary. And the potential bad outcomes if things go wrong, complications.
The big scary ones are hemorrhage, severe bleeding, ulcer perforation, the hole, and the septic peritonitis that follows perforation, all potentially fatal.
Right. So finally, what's the overall outlook, the prognosis?
It really, really depends on the underlying cause. If it's something straightforward like an ulcer caused by an NSAID that's stopped and it's not cancerous, the prognosis with medical treatment is often quite good, especially if caught early.
But if it's cancer?
If it's related to cancer, or if a perforation occurs, the prognosis becomes much more serious, more guarded. Surgery is needed for perforation, and that carries its own risks.
So, wrapping up, GUE is definitely a complex issue. Serious potential consequences, but often identifiable causes, and thankfully, a range of treatments.
That's right. The key really is that partnership between the owner noticing subtle signs and the veterinarian diagnosing and treating appropriately.
And that veterinary guidance seems especially crucial around those common meds, the NSAIDs and glucocorticoids, wouldn't you say?
Absolutely. Understanding the risks, using them judiciously, knowing what signs to watch for, it's all vital for keeping our animals safe while still managing their other health issues.
It's been a really informative deep dive. Thinking about the high prevalence in sled dogs from just intense exercise and the risks tied to drugs we use so often, it really makes you consider the bigger picture of managing animal health proactively. How can we, as owners and vets, work together even better to spot these risks early and minimize them before they become serious problems? It's certainly something worth thinking about. Thanks for joining us.